Is another one of the neighborhoods here, and here to talk to us from Lambton Public Health is Anita Trusler. Thanks for talking to us, Anita. What is this neighborhood that we're standing in right now that you're a part of?
So this neighborhood is actually called the neighborhood of equity, diversity, inclusion, and indigeneity, EDII. So it's really promoting positive spaces, respect, inclusion, barrier-free access to services. And Lambton Public Health is here with many other partners, including Diversity Ed, Sarnia-Lambton Native Friendship Center, the local Native or local immigration partnership, to promote that positive space, barrier-free access, and that making people feel comfortable and making sure our services are inclusive for everyone in our community.
And everybody just feel welcome, and I can say when you walk through the front door here at this expo, it's very welcoming. We've got you, the volunteers. You can see them in the orange vest. They're volunteering their time here today, and grab yourself a go bag that you can fill up with some goodies that are here. But Lambton Public Health, let's talk about that. I mean, you just mentioned several services. I think people think Lambton Public Health and they just, I don't know, they just have this one focus of what that is, but there's so much more to that.
Yeah, and a lot of people don't know what public health does, because when we're doing our job well and the community is healthy, people don't know. Obviously, people know we do vaccinations. We just came out of COVID. They know that we do outbreak management, but we do so much more. So just over my shoulder here, we have our dental team promoting the seniors dental program. We also do a Healthy Smiles program for children and youth. We do all kinds of chronic disease prevention. We're doing a lot of work with community partners right now through the Lambton Drug and Alcohol Strategy to help build a healthier, more resilient communities with community partners. My goodness, there's so much that Lambton Public Health does, from inspecting your restaurants to testing mosquitoes in our area to counting the tick population, letting people know what kind of health hazards there might be. And a new area of focus really is that climate change. You cannot deny climate change is a thing, and it's having a significant impact on people's health. We just had some smoke advisories and air quality advisories last week. So those are amongst the many things that public health does in your community.
Speaking of smoke, what about smoking? That's something that, well, I'm proud to say, I think it was about 8 years ago that I made that commitment, and our friend Becky was a part of that. Talk about that initiative with Lambton Public Health.
Well, I mean, for years and years and years, we know that smoking has a strong correlation to cancer and other chronic diseases like heart disease. Not just smoking, vaping is another risk. We're having to do a lot of education even around things like alcohol, cannabis use, and other substances. So we've come a long way, and people probably don't know that public health was very much behind a lot of these smoking laws that are now in place, similar to seatbelt laws that are now in place that are protecting the health of our population.
Yeah, really important services, and just so much to learn about Lambton Public Health. So take the opportunity today to come down here to the Pat Stapleton Arena. You've heard me talking about it all day so far. It's the age-friendly Sarnia-Lambton Expo, and if you see Anita in the bright orange here and the curly hair, she can't miss her walking around here. She'll answer all your questions, and if you can't find her, there's lots of people here manning the booths at all of the neighborhoods here. There's like 100 vendors here today, and a lot of them have stuff that you can put in your grab bag and take home with you and learn more about their services. Anita, thanks so much, and thanks for being a part of age-friendly Sarnia-Lambton. With the show online, I'm Dave.